Hello, I hope everybody is okay and well. This was probably the easiest way that I could do this to get it out to everybody in terms of just a new policy or a part of a policy that I have to change going forward. The obvious worst and least fulfilling part of our job is documentation, but it's also the most essential to the health of the company and being reimbursed for the great things that we do with patients. Our notes are the only thing that an insurance company pays for. Obviously, we go beyond that, but we have to connect those dots and understand that that the notes are paramount, even though it's the worst thing and the hardest thing to get to and prioritize. So unfortunately, in the last several months, I've come across several different clinicians who are putting off their notes, which is understandable. It's part of the deal, part of living your life, and I understand it's part of the sacrifice of working so hard around your daily life to get things done with our patients. So I do appreciate that aspect of things, and I don't want this to come across as anything other than, me appreciating that to the highest level. But what's happening is the company is paying people based on their payroll reports, and here and there on several occasions I've been cross-referencing the payroll with the notes completion, and there will be notes missing. So the company is paying for that visit and the note is not there, and if the note's not there, we don't get paid. And that's just it can't be that way. We just can't let that happen. Obviously nobody is doing that on purpose, but it seems to be happening more and more as we get more and more busy in our own personal lives. So connected to the email that comes with this video is the policy for documentation. The highlighted area will just reference exactly the change that I'm making, which is as follows. When you are submitting payroll, and you will now see on the payroll form that there is a new column so that you can police yourself and put a check mark in there when your note is completed. When you submit payroll, you will only get paid when all your notes are completed for that pay period. It's too hard for me to try and connect the dots myself. I can't do it anymore. So we need self-policing in that manner, and the sheet should be self-explanatory in terms of that. The one other thing relative to that payroll sheet that I need us to all completely understand is there should be no names written anymore for HIPAA reasons. What we're doing is as the clinician, we're putting the patient's initial in the left patient initial column, and they are putting their initials in the appropriate column. And then the checkbox for when you complete the note. That way, you know the note is in, which I know you all care about, and I know the note is in because you getting paid hinges on that note being within the system so that we can then bill that service out. The highlighted portion of the policy that's attached just basically states the same thing. So when you get that, just take a quick look at it, and then it will start immediately. It's got to start immediately. If there's any questions, certainly you guys can text me or email me, and I appreciate you guys just following along with this. I hate to do it, but it's got to be done from my perspective, from the company perspective. All right. Again, lastly, thank you all so very much for what you guys do for me, for the company, for keeping this thing going, and doing right by patients, and just doing, really amazing things with people out there that deserve better. So I really appreciate it. All right, take care. Thanks.